So what is cholesterol? It's basically a fat, right? A blood fat. It's like an oil. Now, we need cholesterol. We need it for cell membranes. We need it for hormones. We need it to survive. If we didn't have cholesterol, we would die. So you know what? Our liver makes it. It makes it so that we have what we need. So our liver is cranking out cholesterol and triglycerides, which is another form of a lipid. And we eat things, we eat foods that also give us cholesterol and triglycerides from our diet. But 90% of what's floating around in your bloodstream is actually from what your liver makes, not necessarily from your diet. So for people who have significant abnormalities genetically, a lot of times that's because their liver is doing something, it's on overdrive. And to treat people who have genetic problems where their liver is overproducing, sometimes by just changing the diet's not enough, and that's where we bring the medications on board. The problem is, if you have too much cholesterol accumulate in the bloodstream, you can begin to develop plaque in the arteries because the cholesterol, the extra cholesterol floating around needs a place to go. And what happens is it gets into the walls of these blood vessels that basically are carrying blood to feed the heart. If you look at a heart, this is what the heart looks like. You can see those little kind of spider vessels called the coronary arteries. We're talking about cardiovascular disease. We're talking about disease of those tiny little arteries. You can imagine they're actually very small. They're supplying blood flow to the heart itself. Now, if you develop enough plaque in an artery that you cut off blood flow, even to a little piece of the heart, what happens is that heart muscle doesn't get fed blood and it basically dies. That's actually a heart attack when you cut off blood flow to the piece of the heart muscle. Now, if you get yourself to the emergency room and they're allowed to reestablish blood flow, you can potentially save that part of the heart muscle. But sometimes people get there too late. And so a piece of the heart actually dies off, and now they have to live the rest of their life with less than the full heart muscle functioning to keep them alive. And that puts a lot of strain on their body, and you feel very different after you've had a heart attack. Ask anybody who suffered that. Life is different. You don't have the same level of energy that you used to. So our goal is not just to help you once you've had a heart attack to not have another one. Most certainly that's what I want to do for you. But what we ultimately want to do is prevent you from ever having it in the first place. So how are we going to do that? The way we're going to do that is to figure out what's making you at risk. And if you have risk factors, if you have high cholesterol and we do something about it, we can prevent this progress from happening.